Imagine your body is like a complex building made of many different materials like wood, bricks, and concrete. These materials are like the tissues in your body: bones, muscles, fat, and more. Sometimes a mistake happens in the building instructions and one of these materials starts growing in a way it shouldn't. In the case of sarcoma, it's like the connective tissues, the support beams of your body, start growing out of control. Sarcoma is a type of cancer that begins in the connective tissues of the body. These tissues hold everything together, like the glue that binds a building. They include things like bone, cartilage, fat, muscle, blood vessels, and tendons. These tissues are found everywhere in the body, so sarcoma can occur almost anywhere. It's important to remember that while sarcoma is a serious illness, doctors and scientists are working hard to find better treatments. Think of it like a weed in a garden. A weed can suddenly sprout up amongst the flowers, growing rapidly and taking over space where it shouldn't be. That's what a sarcoma tumor can be like. It's important to remember that just like gardeners can remove weeds and help their flowers thrive, doctors can treat sarcoma and help kids get better. Just like there are different types of flowers, there are also many different types of sarcoma. Some grow quickly, while others grow slowly. Some are more common in children, while others are more common in adults. Knowing the type of sarcoma helps doctors choose the best treatment plan. Sarcoma grows when the cells in the connective tissues start dividing uncontrollably. Normally, our cells grow and divide in a very orderly way, like a well-rehearsed dance. But sometimes, there's a glitch in the instructions, and the cells start dividing too quickly and form a lump called a tumor. Imagine a copy machine that keeps making copies of a document even when you tell it to stop. The copies pile up and become a mess. In sarcoma, the cells keep dividing and growing, forming a tumor that can press on other parts of the body and cause problems. It's important to know that not all tumors are cancerous. Some tumors are benign, meaning they are not cancerous and do not spread to other parts of the body. They're like a little bump on a log. Not harmful, but maybe a little annoying. Sarcomas, however, are malignant tumors, which means they can spread to other parts of the body, like seeds scattering from a dandelion. This spreading is called metastasis, and it occurs when cancer cells break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body. There, they can start growing new tumors. Early detection is key to preventing metastasis and improving treatment outcomes. Sarcoma can be tricky to spot because the early signs can be similar to everyday aches and pains. Sometimes there are no noticeable symptoms at all in the early stages. This is why regular checkups with a doctor are important. One of the most common signs of sarcoma is a painless lump or swelling under the skin, often on an arm or leg. It might feel firm or rubbery to the touch. It's important to tell a parent or doctor if you notice any unusual lumps or bumps, even if they don't hurt. Don't try to diagnose yourself. Other possible signs include pain in the affected area, especially if it's a bone sarcoma. The pain might be worse at night or with activity. Sometimes the pain might feel like a growing pain, so it's crucial to pay attention to any persistent or worsening discomfort. If the sarcoma is pressing on a nerve or blood vessel, it can cause numbness, tingling, or swelling in the area. If you experience any of these symptoms, it's important to see a doctor to get it checked out. Don't hesitate to ask questions and share any concerns you might have. Doctors use a variety of tools and techniques to diagnose sarcoma. It's like a detective trying to solve a mystery, gathering clues to figure out what's going on. The first step is usually a physical exam, where the doctor will examine the lump or swelling and ask about your medical history. Imaging tests, like X-rays, Connecticut scans, and MRI scans, can help doctors see the inside of your body and get a better look at the tumor. These scans create detailed pictures that help doctors determine the size, shape, and location of the tumor. A biopsy is often the most important test for diagnosing sarcoma. During a biopsy, a small sample of tissue is removed from the tumor and examined under a microscope. This allows doctors to see the individual cells and determine if they are cancerous. It's like looking at a tiny piece of the puzzle under a magnifying glass to see the details. Once the biopsy confirms the presence of sarcoma, doctors will perform additional tests to determine the grade and stage of the cancer. The grade refers to how quickly the cancer cells are dividing and growing, while the stage describes how far the cancer has spread. This information helps doctors tailor the treatment plan to your specific needs. Section 5. Treating sarcoma. There are several treatment options available for sarcoma, and the best approach depends on factors like the type and stage of the cancer, your age and overall health, and your personal preferences. The goal of treatment is to remove or shrink the tumor and prevent it from spreading. Surgery is often the primary treatment for sarcoma. During surgery, the surgeon removes the tumor and a small margin of healthy tissue around it to ensure that all the cancer cells are gone. It's like removing a weed from a garden, making sure you get all the roots so it doesn't grow back. Radiation therapy uses high-energy beams like X-rays or gamma rays to kill cancer cells. It's like using a powerful spotlight to target and destroy the cancer cells. Radiation therapy can be used before or after surgery, or sometimes as the main treatment if surgery isn't possible. Chemotherapy uses drugs to kill cancer cells. These drugs travel throughout the body, targeting rapidly dividing cells, including cancer cells. Chemotherapy can be given intravenously through a vein or orally by mouth. It's like using a powerful weed killer to destroy the cancer cells throughout the body. Section 6. Looking ahead. Prognosis. The prognosis for sarcoma depends on several factors, including the type and stage of the cancer, your age and overall health, and how well you respond to treatment. The prognosis is an estimate of the likely course of the disease, and it's important to remember that every individual's experience is unique. Advances in treatment have significantly improved the outlook for many people with sarcoma. With early diagnosis and appropriate treatment, many people with sarcoma can be cured or live long and healthy lives. It's important to maintain a positive attitude and work closely with your medical team. Section 7. Total health, more than just physical. When we think about health, we often focus on our physical bodies, but true health is about more than just being free from illness. It's about feeling good, physically, emotionally, mentally, and spiritually. These four aspects of health are interconnected and influence each other. Physical health is about taking care of your body through healthy habits like eating nutritious foods, getting regular exercise, and getting enough sleep. Emotional health is about managing your feelings and coping with stress in healthy ways. Mental health is about your ability to think clearly, learn, and solve problems. Spiritual health is about finding meaning and purpose in life and connecting with something greater than yourself. It might involve practicing your faith, spending time in nature, or simply reflecting on what's important to you. It's about having a sense of inner peace and The power of a positive mindset. A positive mindset can make a big difference in your healing journey. When you believe in your ability to overcome challenges, you're more likely to stick to your treatment plan and engage in healthy behaviors. A positive attitude can also help you cope with the emotional and mental ups and downs of dealing with illness. Think of your mind as a garden. If you plant positive thoughts and beliefs like seeds, they will grow into beautiful flowers. If you plant negative thoughts like weeds, they will take over and make it harder for the flowers to thrive. Choosing to focus on the positive can help you cultivate a healthy and resilient mind. Section 10. Spiritual strength, finding inner peace. Spiritual health is about finding a sense of peace and meaning in life, even in the face of challenges. It's about connecting with something greater than yourself, whether it's your faith, nature, or simply the love and support of your family and friends. Spiritual strength can provide comfort, hope, and resilience during difficult times. Think of your spirit as a strong tree. Its roots go deep into the earth, drawing strength and nourishment. Even in strong winds, the tree can bend without breaking. Cultivating your spiritual health can help you develop inner strength and resilience to weather life's storms. Section 11. You are stronger than you think. Dealing with sarcoma can be challenging, but it's important to remember that you are stronger than you think. You have the strength and resilience to face this challenge head-on. Surround yourself with supportive people who love and care about you. Don't be afraid to ask for help when you need it. Remember that you are not alone. There are many people who care about you and want to support you on your journey. Your medical team, your family, your friends, and your community are all there to help you. Together, you can overcome this challenge and emerge stronger and more resilient than ever before. Believe in yourself and never give up hope.